Welcome to our webinar on our funding announcement called Expanding Collaborative Capacity to Prevent Domestic Violence. My name is Alicia Somji, and I'm an Associate Program Manager at Prevention Institute. And with me today, I have Lisa Fougier-Parks here, who's an Associate Program Director. We're both on our Injury and Trauma Prevention team here at Prevention Institute. And Lisa leads a lot of our domestic violence prevention work, along with work on other forms of violence too.
Good afternoon, everyone.
So Lisa, do you think you can start us off by giving us a quick overview on what this opportunity is about?
Sure. Thanks, Alicia. And I just want to say thank you to everyone who has joined today's web conference. It's nice to see some names that I recognize as well as some names that I don't, and I'm looking forward to spending this next hour together. So with support from Blue Shield of California Foundation, Prevention Institute is going to award 1-year planning and capacity building grants of $50,000 to 5 well-established multi-sector collaboratives that want to integrate a focus on domestic violence prevention into their work, but are not explicitly focusing on domestic violence at this time. The collaboratives will build on their existing strengths and engage in dialogue and planning and building their shared capacity to really intentionally integrate community-level domestic violence prevention into their local work. And the funded collaboratives and Blue Shield of California Foundation and Prevention Institute will all work together to identify lessons and implications that will help to inform future multi-sector domestic violence prevention efforts in California. And this grant is really grounded in the understanding that preventing domestic violence means supporting people and having safe relationships in healthy, equitable communities. And so for this program, we're seeking collaboratives that are addressing community priorities such as affordable housing and economic development and immigration rights and climate change and other issues that help to create safe, healthy, equitable communities. And through the program, collaboratives will reach a common understanding and build shared commitment to community-level domestic violence prevention, and hopefully over time help to break down issue silos and facilitate an integrated and sustainable approach to community health, safety, and well-being. We're going to describe the opportunity in more detail, but I wanted to give that quick snapshot. And now, Alicia, if you could give us an overview of today's session.
Yeah, for sure. Thanks, Lisa. So we're going to be starting off with a word from our funder, Blue Shield of California Foundation, and then we'll get into more detail. Lisa gave us a brief overview on the funding opportunity, but we'll get into a little bit more on what it's all about, provide some background and context of how we got here and what this work is really about. We'll share how to apply for this initiative and then close out with some Q&A. So thank you for joining us for all of this. Before we get into content more, I do want to just give a quick overview of the technology that we're using. So we're all on iLink. Those of you who are just over the phone, if you can join through the iLink platform, that would be great, because we are using some slides. So hopefully those slides did pop up for you right away, but if you can't see them, there should be a tab that says today's slides that you can click on to be able to see what slide we're on. For audio, if you are having trouble hearing us, we do recommend calling in over the phone line, and we've shared the call-in number and passcode in the text chat, and it's also available always on the top left corner of your screen. We also have the text chat box, which many of you have already used to introduce yourselves. If you have any questions throughout, please feel free to use that chat. You can also send private messages to individuals if you'd like to have one-on-one conversations. And we do remind you to please follow, regular web conference guidelines in terms of nice and respectful conversation. We also will be using the polling feature just once right now. So we want to hear from all of you where you're located in California. So the map that you currently see on your screen comes from the California Partnership to End Domestic Violence, and we've just put that up there to help come up with 5 regions here. So we've grouped together North and Far North, Bay Area, Central Valley and Coast, Los Angeles area, and South. And so I'm just going to launch the question right now so that it comes up as a polling question for you all. And the map that was on the screen will also be shared through our website as well. So you can always look at that as you're working on your letters of interest. So hopefully you can see the question right now. So we're asking, where in California are you located? And I'll give it a couple more seconds and then I can share the results. And if you can't see the question right now, there should be a tab at the top that says region that you can click on. All right, I will share those results. So looks like we have some representation from 4 of the regions that looks like folks in Central Valley and Central Coast are busy this afternoon. So hopefully we can reach more of them as well as hopefully reach more people that are in the North or Far North. But looks like we do have some representation across different regions. So I'm going to withdraw that question, and hopefully that took you back to the slides, but if it didn't, if you can just click back on today's slides. And with that, I'd like to hand it over to Carolyn. Carolyn Wang Kong is a Senior Program Officer at Blue Shield of California Foundation. In her role, she leads the Foundation's Collaborating for Healthy Communities initiative, under which this offering sits. So I'll ask Carolyn if you can just unmute your line again, and I hope we can hear you.
Great. Thanks, Alicia. Can you hear me?
Yeah, we can hear you. Thanks.
Great, great. Okay. So let's move on to the next slide, please. Thank you. So I wanted to just give a little bit of background about Blue Shield of California Foundation, and we'll delve right back into the this particular offering. But just some background is really for the past 2 decades, Blue Shield of California Foundation has been really focused on working to improve the lives of all Californians. And specifically, our mission has really revolved around this notion of building lasting and equitable solutions to make California the healthiest state and also to end domestic violence. So we've made some great strides in both the safety net in California in both healthcare and domestic violence. But as we are looking at the complex challenges that we're still facing today in our state, it's clear that that focusing on the most immediate and pressing needs is important, and we need to also develop new solutions and approaches to really get at these issues. And so in January of this year, our foundation shifted our strategic direction to really ensure that our work becomes much more transformative in transforming the health and well-being of all Californians. And so here on this slide, you see our bold goal, which is really wanting to make California the healthiest state in the nation with the lowest rates of domestic violence. And so our work going forward is really geared towards accomplishing that goal. Next slide, please. Great. So how we're planning to accomplish that, and that strategy is really driven by these 3 initiatives that you see here. And these are really integrated initiatives that are designed to help us get to the root causes and drivers of health and domestic violence, as well as the interactions between the people, families, and then the systems that serve them. So the first initiative is breaking the cycle of domestic violence. And here we really are recognizing that domestic violence starts with early exposure to violence and or child abuse. And that that exposure really creates a pipeline of then adolescents and adults who then are faced with DV in their adult relationships. And so the question that we're really raising here is, how do we disrupt that pipeline, and how do we pay close attention to families and communities as we design approaches to disrupt that pipeline? The second is around collaborating for healthy communities, under which this particular offering sits. So here, we're really realizing that health and domestic violence are driven by lots of different social forces that are managed within different sectors. And so within this initiative, we're really focusing on how can we use collaboration across these sectors to advance health, well-being, and safe relationships. And so really, and you'll see with this offering, we're really about being able to see domestic violence not just as a private issue, but a shared issue that impacts families and communities. And so how do we engage different sectors in the prevention effort? The last initiative that is really driving our strategy is this one around designing the future of health. And in this area, we're really focused on the long game here, recognizing that we're facing lots of growing disparities that range in the areas of income inequality, violence, housing, poverty, and all of these disparities impact our health and our ability to have safe relationships. So here we're focused on exploring what it'll actually take to solve these tough challenges and generate some breakthrough solutions that will set us up towards a longer-term path to health and well-being. So with that, that gives you kind of a snapshot of our foundation and where we're focused, and then hopefully a clearer sense of how this offering fits in within that. So Alicia, I'll pass it back to you.
Thanks, and I'm just going to pass the baton right over to Lisa.
Thank you. So yes, this is Lisa, and I really want to express so much gratitude to Carolyn. We're really grateful to partner with you and others at Blue Shield of California Foundation over many years now, and how wonderful that the foundation is committing to this bold goal of making California the healthiest state with the lowest rates of domestic violence. So thank you for this opportunity to partner. I wanted to tell you that Prevention Institute, and you can see an image of our building there on that slide, we're a focal point for primary prevention, which is really about fostering health, safety, and equity by taking action to build resilience and to prevent problems. We're a national nonprofit with offices in Oakland, Los Angeles, and Washington, D.C., and we partner with communities. And we advance strategies, we provide training and technical assistance, we translate research into practice, and we support collaboration across sectors. And we do all of this to catalyze innovation, advance policy and systems change, build momentum for prevention and well-being and health equity, and really support healthy, safe, and equitable communities. We were founded in 1997, and since then we have focused on partnering with communities on issues such as health equity, injury and violence prevention, healthy eating and active living environments, transforming our health system, and promoting mental health and well-being. So this grant program is really a culmination of collaboration among many leaders and communities and sectors across California and beyond California over many years. And building on this legacy and deep commitment to partnerships and expanding partnerships, we are now seeking to partner with collaboratives in California that are working locally and are well established and functioning with a high degree of trust in their community, are comprised of representatives from the communities of focus in a variety of sectors, that have a track record or a focus on improving community conditions from a prevention perspective, and as I mentioned earlier, are not centered explicitly or primarily around domestic violence prevention at this time, but are really seeking to integrate that focus into their work. In terms of our role in this effort, we are going to play some various roles in the program, including selecting the sites and administering the grants, capacity building, including technical assistance and coaching, supporting a multi-site learning community, connecting the work to additional related initiatives and partnerships, really ensuring that this is a learning experience for everyone involved and that it catalyzes innovative approaches to community-level prevention in California. So by investing in capacity building and planning over the course of a year, the intention is that for each of the 5 local collaboratives to have, at the end, or by the end, greater shared understanding of domestic violence as a relationship and a community issue. New partners or stronger current partnerships that can reduce the community-level risks and enhance community-level resilience in order to prevent domestic violence. And that promotion of safe relationships and prevention of domestic violence from a community-level perspective will be adopted as an ongoing collaborative priority. In addition, we understand that there is a need to be able to respond to incidents of domestic violence, either current or past. And so collaborative capacity and protocol will be developed and or enhanced to address those disclosures and those incidents. Further, work plans will be developed or updated to include new community-level domestic violence prevention strategies and or to integrate community-level domestic violence prevention components into existing strategies. And as I mentioned, this effort is really about learning as we go, and so lessons learned and suggestions for how to approach this work will be reflected upon and shared with the statewide learning community. So those are our expected outcomes, and I wanted to turn it back to you, Alicia, to describe a little bit more of the background and context for how we have designed this program in this way.
Yeah, for sure. Carolyn gave a little context on Blue Shield and their strategic direction. So with support from the Blue Shield of California Foundation and in partnership with representatives from multiple sectors, including domestic violence prevention advocates and researchers, Prevention Institute developed Sectors Acting for Equity, which we also call SAFE, a health equity and multi-sector approach to domestic violence prevention. And through this project, Prevention Institute has been working with leaders at the state and local levels to address the underlying determinants of domestic violence and build community environments that support safe relationships. So we do invite you to take a look at our SAFE publication page, which has been shared in the text chat. And there you'll find both an overview of our SAFE approach as well as the larger report. I did want to note that SAFE is being presented here to provide examples and context, but your letters of intent or interest do not necessarily need to focus on the sectors that are highlighted in the report. They can be outside of that scope as long as your work is multi-sector in approach and community prevention oriented. We also want to take a moment to thank our many partners at the state and local levels across sectors who have provided their guidance and input and have really helped us in continuing to refine our approach. So we're now going to just share briefly what this approach really is about.
So I'll start us off, Alicia, and the key elements of the SAFE approach that we're going to talk about really reflect our commitment to learning in partnership. And so over time, working with different communities, these are some of the elements that continue to rise to the top as being important for having success on community-level prevention on domestic violence. So we wanted to lift them up to help give some insight on what we've learned. So the first is about leading with health equity and social justice. So this means, for example, really recognizing and precisely identifying and then countering the unequal and unjust conditions that contribute to domestic violence and inequities in domestic violence. There are inequities in rates of domestic violence throughout California, and consistently young women, people of color, women with low household incomes, and LGBTQ individuals experience higher rates. And so leading with health equity and social justice, in part, is about addressing the conditions that create those inequities, and also ensuring that community members that are most impacted drive the prevention work.
So our next key element is all around changing community conditions through underlying contributors. And so this really has to do with understanding what's happening to our communities, what's happening in our communities. And to do this, we look at community-level factors that, through research, we have seen to increase risk of domestic violence. And the types of factors that we've come across in our research have included harmful norms, weak social networks and trust, housing and economic insecurity, and this is kind of why we see actions of multiple sectors being important for taking on this issue, because a lot of these conditions can be changed through multi-sector efforts.
Great. And the third key element is promoting community resilience. And that's about focusing on enhancing community and cultural strengths to answer the question, how do we amplify what's going well in the community? And so this includes bolstering resilience at a community level by supporting factors like healthy norms and culture, strong, cohesive social networks, safe, affordable, and supportive housing, and economic opportunity.
And then next, we have collaborating across sectors and social movements. I won't get into this as much since I think I've already mentioned when I talked about the different community conditions, how they really are shaped by different sectors and social movements. And we've seen that having authentic engagement with community members, as well as culturally rooted organizations committed to racial and gender equity, as well as multiple sectors, to all be very critical to preventing domestic violence before it happens.
And finally, attending to prevention and healing. The solutions in communities really need to, the solutions that are focused on reducing future violence really need to also acknowledge and address the harms of current and past violence. And so this may mean integrating individual and community healing and accountability practices, for example, healing circles and other culturally rooted practices, restorative justice, and other practices that, again, help to hold domestic violence as a community issue and helps to move forward in preventing it while also helping to heal the violence that's already occurred. We've covered a lot on these key elements, and we just wanted to reiterate our documents that describe these elements in further detail available on our website.
And the overview of the Safe Approach document does include some examples of action again, but they aren't meant to be these are the exact things that people need to be doing. They're more just examples to help illustrate the concept.
Absolutely. So here's a diagram, and I'm going to just share really briefly a little bit more about the concept of leading with health equity and social justice and changing community conditions, if visuals are helpful. So our focus in this grant program is to reduce domestic violence and inequities in domestic violence, represented by the square on the right. But in order to do that, we first need to look at the exposures and behaviors that are associated with domestic violence and inequities, such as people's multi-generational history of violence or witnessing violence, as Carolyn mentioned at the beginning of this webinar, especially at an early age. Other exposures like social and emotional isolation, lack of healthy role models and relationships, adherence to norms of violence, and living in a context where perhaps communities aren't taking strong action to address or prevent domestic violence. These all help to contribute to greater rates of domestic violence and inequities in violence. So then we can ask ourselves, well, what is driving and shaping those exposures and behaviors? And that really brings us to the structural drivers and what we call the community determinants of domestic violence. And the structural drivers are those broad drivers of inequitable distribution of power, opportunity, and resources, from racism, sexism, and other forms of disenfranchisement. And then the community determinants refer to the factors in the environment in which people are born, where they live, work, connect, and play, that are associated with increased likelihood of domestic violence. So when we say leading with health equity and social justice and changing community conditions, we really mean that we're focused on changing the structural drivers and community determinants or the community conditions in order to reduce the rates of domestic violence at a neighborhood, community, or population level. And Carolyn described this earlier as getting at the root causes.
Thanks, Lisa. And I know that that can all be a lot, and so I find this quote to be helpful to help conceptualize what that pathway is all about. And the quote that we like to use a lot at Prevention Institute from the Institute of Medicine. And it says, "It is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change." And so that makes us ask, what can we really change in our environment to prevent domestic violence and behaviors that are associated with it? So a little more detail here. Again, this is a lot, and we do recommend looking at the overview that we've shared in the text chat and is available on our site. But when we talk about those community determinants of domestic violence, which are also known as risk factors at a community level, this slide here basically just outlines what we came across through our work. And it's split into people, place, and equitable opportunity. So the people is really about the socio-cultural environment and how things like having weak connections in neighborhoods or harmful norms that promote gender inequities can increase the likelihood of domestic violence. Or in the place cluster, we can see how things in the physical built environment like housing insecurity or harmful media and ways of promoting products can increase domestic violence. And then in the equitable opportunity cluster, how a lack of living wages and local wealth, so things like unemployment and that type of thing, can contribute to the issue as well.
And so we also wanted to identify, well, what community conditions or community determinants can promote safe relationships in which there isn't domestic violence. And the research on resilience factors or protective factors, particularly at the community level, is actually quite limited. But there are a number of interrelated factors for which there is emerging evidence of association with safe relationships and reduced likelihood of domestic violence. And so we drew on the best available research and also our discussions with practitioners and advocates from within the domestic violence community as well as other sectors to frame a set of community determinants that support safe relationships. And there's more information in the products on our website, but we wanted to share these with you and just to reiterate that these are really grounded in research as well as practice. And on the next slide, you can see a quote from a participant in a web conference that we shared, where we shared about this approach. And I was really grateful that a colleague who is a leader in another state who has an incredible experience and success in this work shared with us that the framework resonates and that it helps to create a path forward. And that is really the intention by identifying really what's underlying domestic violence and inequities in domestic violence, and that what, on the other hand, can really facilitate and be conducive to supporting safety in relationships. The intention is then to be able to bring people together to create a pathway forward for community transformation. So the ideas are not new necessarily, but they've really been updated and synthesized and represent the evolution of ideas and research and examples of community action. And now we're at a new moment where we can further expand collaboration and partnerships. And our hope is that as more and more communities expand their attention to domestic violence prevention and engage multiple sectors and build shared capacity, there will be even greater diversity and creativity of approaches and understandings of how to go about doing community-level domestic violence prevention in California.
Thanks, Lisa. So now to the, I guess, fun part, how to apply. So I did want to say this is a California-based opportunity. The program requires one agency to apply on behalf of a collaborative. And while we understand that some collaboratives may have multiple lead agencies, we request that the designation of one agency to lead this grant. And the lead agency must be a current 501c3 organization or a public agency, and have the ability to distribute financial and other resources to collaborative members, and assume responsibility for completing all grant reporting and administrative requirements. So applying is a two-step process, and it's really designed to be appropriate for its size, scope, and purpose. We don't want this to be too labor-intensive, and that's one of the reasons we've made the letter of interest process really only require 3 pages. So letters of interest are to be submitted by August 6th, no later than 5 p.m. Pacific. And then those who are selected to move forward will be requested to submit their full proposals and provided instructions on that at that time. So yeah, as I mentioned, letters of interest, the narrative section should not exceed 3 pages in length, and we know that that's a short amount for the questions that are being asked in the package. So, you know, this really does require you to be brief and concise and kind of address as much as you can in terms of community, applicant strengths and capacity, commitment to expand capacity for community-level domestic violence prevention, and then just a couple of sentences on budget.
So hopefully by this point we've given you a fairly clear idea of the intent of the grant program and what we hope to accomplish. So a little bit more then on the types of collaboratives we're seeking to partner with and how we're going to make the decision about who to select. So geographic diversity of the state is really important. So we definitely value participation from the 5 regions that we identified earlier. Our commitment to health equity and social justice includes focus on communities and populations experiencing significant inequities in rates of domestic violence. Attending to that is going to be very important for reducing the rate of domestic violence for the state as a whole. We're also really interested in collaboratives that bring unique strengths and present opportunities for creativity and learning to help end domestic violence in California. A commitment to expanding capacity for community-level domestic violence prevention is essential. And there are a number of collaborative strengths and capacities and some lead agency capacities that are spelled out further in the funding announcement. And we're looking for collaboratives that, from our experience, possess these strengths so that they are positioned to have success in this opportunity.
We also wanted to recap some important dates to remember. So the funding announcement has already been released. You're on the webinar right now, so you obviously already know about that. Deadline again for LOIs, August 6th. And then those of you who are invited to submit full proposals, you'll be notified and then provided a month to get your full proposal in. and you'll find out about the funding award by October 12th. And we'll also be hosting a kickoff meeting in Oakland, November 7th to the 9th. So you would need to be available for those dates. So at this point in the webinar, we want to ask you what questions you have. I know some of you have already been posting questions as we've gone, but please share any additional questions in the text chat box at this time. We're going to try to get to as many as we can answer at this time, but anything that we don't get to right now, we will follow up with you, and questions that are frequently asked we will also post on our webpage. If you are currently only participating through the phone line and aren't on the iLink platform right now, you can email your questions to abina@preventioninstitute.org, and then we'll be able to respond to those after.
And Abina is spelled A-B-E-N-A.
Oh, right.
Prevention Institute.
Because those of you who are currently listening can't see the slide with her name. Sorry. Okay. So Lisa, do you want to start us off with, we've gotten a few questions already through email, so I'll let you get started, and I'll start seeing what other questions there are.
Perfect. Thank you. So one question is, my organization is not a 501c3 or a public agency. How can I apply? So we recognize that there are many agencies, organizations that are very qualified to participate in this type of work that may not be a 501c3 or a public agency. So organizations or groups like that that participate in collaboratives would not be able to apply as the lead agency for the purpose of this grant. We would ask that an organization within that collaborative that is a 501c3 or a public agency apply as the lead agency on behalf of the collaborative for this grant. The funds would be awarded to that lead agency, and we would expect that that agency distribute the funds as appropriate within the collaborative and within other partners that would be involved.
We have gotten a question about if someone is already funded by Blue Shield, or if they've submitted an application for another RFP, are they eligible for this one?
Great, thank you for that. Existing Blue Shield of California Foundation grantees are definitely welcome to apply. As for the question about whether applicants can apply to multiple funding opportunities, we'd like to answer that question offline. So we'll compose a response and make that available through Prevention Institute's website after this web conference.
Great. And then I know we had a question earlier about can someone outside of California apply? And so this is a California-specific opportunity, so the work and the collaborative needs to be within California. Yeah, do you want to go ahead?
Sure. Another question that we've received is the question, our collaborative does some work related to domestic violence already. Does this mean that we do not qualify? So the grant program is intended to support communities that are impacted by domestic violence, to bring together multiple sectors with a range of perspectives and capabilities to influence community conditions and facilitate community change. So given that, we imagine and hope that the collaboratives we partner with will have done some thinking around and some work around the issue, recognizing the impact on the community. So it's not a problem if your collaborative already is doing some work on domestic violence. That said, we are seeking well-established collaboratives that are addressing community conditions such as affordable housing, economic development, immigrant rights, climate change, etc. So that means that we're seeking to partner with collaboratives that are centered around community-level change and prevention. So the distinction that I do want to make is that we recognize that coordinated domestic violence intervention services are vitally necessary, but collaboratives that are primarily centered around coordination of domestic violence intervention services would not be a strong match for this opportunity.
We had a question come in about the regions. Will you please repeat the 5 regions that have been identified as priority areas? So we don't necessarily have priority areas. We're more just wanting to make sure that we have some geographic diversity within California in who we fund out of the 5 collaboratives that will be funded. So we just provided 5 regions of California, but there aren't any priority areas per se. Another question that we have is, my organization works with several others in a rural community, but the focus is not primarily DV at this time, domestic violence at this time. Are we eligible to apply? And the answer to that is yes. We are looking for those who haven't taken on this issue in the past. So for sure you're eligible to apply as long as integrating domestic violence prevention into your work is of interest to you and your community. Great. Yeah, do you want to go ahead?
Sure. Another question we've received, and I wanted to actually ask Carolyn to respond to this question. Carolyn, we've been asked the question, will there be funding for this program after the first year? Would you mind responding to that question?
Sure, I'd be happy to. Yeah, so we specifically designed this round as planning grants because we really recognize that if we're trying to really embed DV prevention into collaboratives that are already at play but maybe not focused on DV, that there's a ramp-up period to that and some capacity building and knowledge building. And so our goal as a foundation is really, we're very, very curious about how to engage new partners and new stakeholders in DV prevention. And so we do expect that that we would make this first round of grants with Prevention Institute and with this first cohort and do a lot of, as Lisa mentioned, learning together around really what it's taking to weave DV into your work, what the value proposition is, and how do we continue it in a sustainable way. So our hope is to be able to then offer additional funding in out years as these ideas get developed, and we'll have to do some work together to understand, what readiness would look like for implementation beyond these planning grants, but that would be our intent. And Lisa and Alicia, I also want to kind of go back to another question that was asked about, if folks have applied for the Value of Prevention RFP that our foundation offered. I know we said we would answer that offline. I can just do it real quick. I think our perspective is that, really because our foundation's in this place of a new strategic plan, there's a number of different offerings coming out, and I would say really to look at the offerings individually based on strategic fit to what you are planning to do or your collaborative is planning to do, and there's no sort of rules around applying to multiple offerings. I think really for us it's more about making sure that whatever the offering is, it's the best fit for what it is that you're interested in doing. So.
Thanks, Carolyn. We had another question about what type of expenses can the funds be used for. We'd invite you to look at the grant package or application package for details on that. And if you need further clarification, if you could just email us on that one. We've had a lot of questions about this whole notion on DV, domestic violence focused versus not focused. Like, can I apply if someone in our collaborative is already focused on domestic violence or doing domestic violence intervention versus ones who currently don't even focus on it at all? Maybe we can talk about that a little bit more, Lisa.
Sure. I really appreciate the questions, and so again, it's not a problem if your collaborative is already doing some work on domestic violence, and in fact, we would really encourage participation within the collaborative of organizations that are addressing this issue. And also, one of the expected outcomes is that the collaborative build capacity to be able to respond to incidents that are surfaced as part of the collaborative's work. So definitely doing work on domestic violence or having partners at the table who are working on domestic violence is not a problem at all. That's great. The issue really is around, does the collaborative center its work and have the capacity to center its work on community level change and influencing the community factors that are contributing to domestic violence. So if you have the ability to do that, that's the type of collaborative that we're seeking to partner with.
There was another question about, is there a framework for the number of agencies that should be included in the collaboration? I don't think we have a set number of partners required, but we just really do want multi-sector partnerships.
I could imagine that in larger geographies, there may be more partners, or more mature collaboratives may have more partners who are working on multiple issues in an integrated way, and that maybe smaller collaboratives that are focused on smaller communities or smaller geographies might have fewer partners. I also understand that in rural communities, sometimes there just is a smaller number of groups with whom to partner. So there's no recommended number there. We've also gotten another question about what kinds of activities the collaboratives might engage in as part of the part of the planning and capacity building. So we're really interested in hearing from collaboratives the kinds of activities that they think will help to get to the expected outcomes that we outlined earlier in this presentation. So how would your group build shared understanding around domestic violence as a relationship and community issue? How would you identify what kinds of factors to influence within your community, and how would you bring those folks who have the ability to influence those factors to your collaborative and onboard them to this work if they are not already a part of your collaborative, or help them become a strong partner in this work if they are already a part of your collaborative? How do you integrate this issue into your collaborative's priorities on an ongoing basis and into your work plans? We're curious about how you might go about that, and don't have a prescriptive methodology per se. That said, we do imagine that getting to those outcomes will require a period of authentic community engagement, authentic dialogue across populations and sectors within your community and within your collaborative, iterative exploration and planning and decision making that's inclusive, and sharing that process with the other collaboratives that are engaged in this grant program, and with Blue Shield and with Prevention Institute over time.
Thanks, Lisa. We had a question about grant reporting requirements. So I do want to emphasize that this is a planning and capacity building opportunity. And so a lot of the reporting will be more on really telling the story of what happened, including photos, stories, etc., and really capturing key lessons, progress that you've made towards those expected outcomes. And we're hoping that together, by pulling all the information together, we'll be able to provide some recommendations for the future and learnings for the state on this topic. So it's not super rigid reporting requirements, but we do want to be learning as we go. There was another question on populations of focus. Is it feasible to focus on one age cohort, or do we need to cover all ages and all groups? So the focus of this opportunity is on community level factors. So if within that a collaborative is interested in narrowing in a little bit more within a certain group in the community, I think as long as it's focused on community level factors, that would be okay to do so. What else?
There's a question about whether the collaborative has to be a formal collaborative that has been in existence for a certain length of time, or can it be a collaboration that has recently begun forming? So the intention with this grant program is to work with more well-established, mature collaboratives that are already engaged in prevention, community-level prevention-oriented work. So it is not intended to support the formation of new collaboratives or collaboratives that are in that phase of their work. We've been asked the question, this is detailed about the applicant process or the application, the LOI process. For the narrative is the budget part of the 3-page limit, and at this point, for the letter of interest, we're not asking for a full budget. We just are interested in a couple of sentences of how you anticipate using the funds. So yes, please include, respond to the question about the budget as part of the 3-page narrative section.
We had a question on, I feel like we may need more information on this, but the question was, is the intent for all collaborators to be funded, or may some be funded and some unfunded? So the lead agency will be getting the funds from us, and then it's their responsibility to determine and disperse funding.
Yeah, and
agreed upon within the collaborative, I guess.
Yeah, and we don't have a prescription around that other than to consider what type of support might be needed to facilitate full participation among the partners within the collaborative. We also anticipate that there might be value in offering stipends and other forms of reimbursement so that community members can participate in the planning process, can participate in the collaboratives as participants. And so it's really about attending to concerns around inclusion and participation and what will support that.
Anything else coming up? Oh, Carolyn, anything else on your end? I'm just going to read what this new.
We don't have anything else on our end.
Okay.
It looks like there are a couple new questions.
Yeah, so there's one on, given that this is a planning grant and only $50,000, what distinguishes capacity development and planning from services? So I think this grant is really about using the time to think and act differently and really get to those community level factors and not necessarily just the immediate services that organizations may be used to turning to. Lisa, do you want to say anything else about that?
Yeah, I would encourage you to take a look at the funding announcement and guidelines and the section on allowable costs. So the expenditures for this grant should be to cover personnel costs for staff who will implement or enhance the effectiveness of the planning and capacity building, costs related to data collection and analysis, engagement of community members and other stakeholders, in the planning and capacity building process, dissemination of findings related to the planning and capacity building, costs related to planning, community building, training, learning exchange, consultants, and so on, hiring facilitators or technical assistance providers that will support the planning and capacity building process. Those are the $50,000 is intended to support those kinds of costs, and not to support staff who will be delivering programs or services.
And then our other question is, what if our organization itself is multi-sector rather than a multi-agency collaborative?
I think we would need a little bit more information on how the organization is multi-sector and how the organization would broadly engage relevant partners in the community to be able to affect community change. So we'd appreciate if you could send that question by email and we can respond.
Well, with that, I think we can probably end off our webinar for now. Anything that we didn't get to, we will follow up by email. You can also feel free to email abina@preventioninstitute.org. Again, it's abena@preventioninstitute.org. And we want to wish you luck in submitting your LOIs. We're really excited about this opportunity and looking forward to partnering with the collaboratives. Anything else you want to say, Lisa?
Just thank you very much for participating, and we look forward to being in communication.
All right. Thank you, everyone. Have a great day.
Have a great rest of your day.